So the wraparound program for French-speaking seniors was developed in response to some of the needs of the French-speaking community who wanted to have some services for isolated seniors. So it is a partner program of our larger wraparound program for immigrant and isolated seniors. The intention of the program is to really identify seniors who are falling through the cracks, who may or may not be connected with services in the community, but allows the wraparound facilitator to meet with the senior, meet with their family members, identify what their needs are on a wide variety of areas, whether that's social, financial, their housing, their language issues, their recreational, and put together a plan that includes both formal and informal support networks based on what the senior needs to be able to stay healthy and happy in their homes. This program is just for seniors, so we do use the age though of 55 and older, because what happens often with very isolated communities is the aging process actually starts earlier and that sense of isolation happens earlier. So intervening at an earlier age than a traditionally senior defined at 65 really allows us to do the preventative work early.
We also refer them to this group, the Francophone group, because it's a way of socializing and having friends and getting a circle around. Since we visit the client and we see that the client is alone home, they need a family. This is what they mention as, we live here as a family. This group, when they come to this group, they have social circle in French, and then they can feel no longer lonely.
J'aime le programme beaucoup parce que j'ai eu beaucoup d'aide. Pour moi, c'était une occasion d'être encouragée, d'être aimée, d'être pareil comme une famille. Et puis ça, c'était plus le genre de wraparound pour moi, parce que c'était tout ça pour moi.
A client may come to us either as a self-referral, as a referral from another agency who deals with the client and is aware of the needs of this person, through their family physician, through their family, through their friends, through their neighbors, through their faith group or other organizations. The intent of wraparound is to help this client to remain at home independently and safely for as long as possible. The voice and choice of the client are guiding principles of wraparound. Everything that we do is with the client's choice and the client's approval. What we do when a client is referred is he or she will meet with one of the two French-speaking wraparound facilitators. The client, as I say, is the key factor. In the engagement process, which is the first part of wraparound, we get to know the client. We work with him or her to know what their strengths, needs, and goals are, what they think are the barriers to them continuing to live in a safe, independent manner. This is very individual. Every person is different. Their needs may have to do with items such as finances, housing, being in a safe housing where they can feel that they can get up and down the stairs, where their walker or rollator or cane is safe, where there isn't something they will trip on. It is access to appropriate health services, such as having a family physician that speaks French, or knowing that you can bring an interpreter with you. Knowing where to access things such as programs that will help cover the cost of that needed walker or that needed piece of equipment or device. It's knowing where to go if what there is a matter of isolation, knowing that there is the French language seniors group that meets twice a week. Everything is very customized and individualized to the person's needs.
The people think if you're talking about Francophones or French-speaking people that it is the same group of people, and in fact we have people who are French-speaking from Ontario, French-speaking from Quebec, French-speaking from the Acadians, from the East Coast, even French-speaking from the prairies, let alone French-speaking from Africa or Vietnam. So it's often for a number of immigrants, it's their second language, but it's their dominant second language. So they may speak Swahili but also speak French, or Vietnamese and also speak French, so that they can access sort of one of those official languages in Canada.
It's really important to have the ability and possibility to get what you want, what you'd want to do in your language, because language is something that is belonging to someone. It's your identity, I mean. So you feel free, you feel more independent, you feel just like as yourself.
And in London, many people who speak French and have French as their first language have been used to receiving services often in English. Being able to have a service in French, particularly for seniors, is important, particularly as part of the aging process. So, for example, a senior who may have been functioning quite well in English, but may be experiencing dementia. We know that dementia impacts on language quite early in the dementia process. So someone who may have been able to function in English now is no longer able to function, and it can be frustrating and surprising for their family members and care providers. So having a program that specifically focuses on the needs of French-speaking seniors is really helping to bridge that gap. We do work with a number of other service providers thinking about how they can improve their services and accessibility for French-speaking seniors. So it's not only about providing that direct service, but providing that bridging component with other agencies.
C'est plus easy en français parce que je peux m'expliquer plus. Et puis, pour le parler en anglais, il faut toujours parler moitié-moitié. Il faut parler moitié-moitié. Je vous encourage tous de venir à expériencer comment est-ce qu'on peut avoir pareil comme une famille. C'est bien beau. Moi, si j'ai rapport ici, ça m'a... comment est-ce qu'on dit ça?
Tu planifiais à rester à la maison seule?
Oui, je resterai à la maison seule. Et puis, j'étais bien découragée. Et puis, j'étais pareil comme que à la maison tout le temps. Et puis, personne voir. Et puis ici, on voit tout le monde. Et puis, on parle, on rit beaucoup. Et puis, on se taquine. Et puis, on est pareil comme une famille.